Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. And in honor of Mental Health Awareness Month being May, we're bringing Park Royal Hospital back on the show today. So I just want to thank Lisa Mann for joining us today. How are you?
I'm doing great. How are you?
I'm good. Thank you so much for asking. So tell me a little bit about yourself and the role that you play at Park Royal.
So I'm a certified physician assistant in the state of Florida. I'm currently practicing at Park Royal Hospital. A physician assistant is a mid-level provider. You may be familiar with nurse practitioners, very similar to that. And we work in collaboration with the psychiatrist. So in Park Royal, I work with the psychiatrist to check in on our patients on a daily basis. I make sure that their symptoms are being managed correctly. I talk with them about anything that may be bothering them that day. And I can always refer back to the supervising doctor if there's any need for them to intervene. So at Park Royal Hospital, we work both inpatient, so patients that were admitted either under the Baker Act or voluntarily for treatment, as well as our outpatient program, so patients that come in and then leave and go home at the end of the day. We treat a wide variety rather of conditions. So we have our geriatric population, which is large in Florida. We have our addiction medicine patients, our depression, anxiety, bipolar, and even our acute psychosis, so patients who are having disturbances in their perception, who are seeing and hearing things. We can treat that as well.
So these are some of the conditions that you treat. What are some of the options, like treatment options that are available there other than your inpatient, outpatient?
So the other treatment options that they have while they're with us, we have medication management on a day-to-day basis, so adjustments as needed. And then we also have counseling that is provided by our therapists. We mostly work in group sessions, so they're given resources and tools, worksheets to work through specific issues. We talk about things like boundaries, negative feelings, managing stress, and that's every day with our therapists. Now, we can refer them to outpatient services as well. So we do have our outpatient program at Park Royal, and then we can refer them to our partners in the fields where they can see a psychiatrist and counselor after they leave our services.
Okay, so those are some of your options for outpatient therapy, correct?
Yes.
Okay, perfect. And I know that a lot of people are probably having some mental health issues right now. I know I can speak for myself and say that this has been a very trying time. What advice would you have for someone that is seeking treatment or just looking for a lending ear to talk to?
Well, I think that the amount of people that meet that criteria, the amount of people that feel they're struggling with their mental health is really the majority right now, because there's a lot going on. I mean, if you're not worried, I have questions for you. There are things to be concerned about. However, we want to make sure that the worry is not impairing your day-to-day function, that it's not hindering your quality of life. So if you feel like you're getting to that point and you feel like every day you're just constantly heart racing, you're not enjoying things the way you used to, there are a lot of options. It can be very intimidating. The first thing I want people to know is that it's not something that goes on your record. There used to be in the past a lot of stigma. You know, if you saw a psychiatrist, you were not well and people should be worried about you. It's actually very normal to see somebody for depression and anxiety, especially if you're handling a lot, if you're working in a very complex field, or even in your personal life. You know, if you're a parent and you're working with your children, especially now that they're home a lot and it's a lot of stress for you to raise these children, it's very acceptable to seek help in managing these symptoms. And it may not be long term. You may not need medications or therapy long term. It may be just a little cushion for you at this time in your life. So I would recommend people to not be worried about the stigma. And I would also want them to be aware that the degree of involvement is entirely up to you. So if you want to go to an inpatient setting and have a couple days away from your stressors, that's an option. If you want to do our IOP program or our PHP program, which is daily, I call it mental health summer camp because we give you lunch and we have activities and you have a psychiatrist and a full team there. That's an option. And obviously a lot of people can't be that committed. So even to the degree of just telemedicine appointments from the convenience of your couch, you can do that too for 15 to 20 minutes. It's really in your control of how much time you want to invest in this.
That's awesome. I actually think it's the quite the opposite. The stigma now is if you're not seeing a psychiatrist, something may be wrong with you. Like everybody needs to have someone to talk to. And I'm just really happy that we're breaking that stigma because I feel like it's so important that we talk about this. It's especially in this unique time. So I just want to thank you so much for coming on the show today, Lisa. We appreciate you having you. We appreciate our relationship with Park Royal, and I just hope you have a fantastic day.
Thank you so much for having me. I really appreciate the opportunity to talk about what we do. I'm really excited about helping people through these issues.
Fantastic. And I'll make sure everybody has your contact information once we go.